Good afternoon. I'm Kayla Kovarna, the Executive Director of the American Heart Association in Central Iowa. And today I'm here with Dr. Eduardo Antezano with Unity Point Health. He's a cardiologist here. And today we're going to be talking about hypertension, commonly referred to as high blood pressure. Many people have heard of blood pressure. One of the things that we're talking about today is the fact that the American Heart Association, along with 11 partnering organizations, actually updated our guidelines in 2017 regarding blood pressure. And so that was the first time we've done that in 14 years. So it's really important that people are aware of what these mean and how they can impact their health. And so today we're going to be talking about that and asking Dr. Antezano a few questions and really having a conversation about how that can impact your health and how you can be a champion of making sure that you have appropriate blood pressure. And so thank you so much for joining us and thank you for being here.
Thank you, Kayla.
Yes. And so one of the first things that I think would be important for us to discuss is just what is, when we talk about measuring our blood pressure, what are we measuring?
Yeah. So blood pressure is a measure of the pressure of the circulating blood in the blood vessels. Specifically for arterial blood pressure will be the pressure of the circulated blood in the wall of the arteries.
Okay.
And it's a marker of what the systemic blood pressure is, which can lead to other cardiovascular comorbidities that we'll talk about.
Yeah. Okay. So like if somebody has plaque in their arteries, that would slow their blood pressure down, or it increases it?
So the plaques could be a different process that goes along with blood pressure, but also with hyperlipidemia.
Okay.
But in most of the patients, these two processes go together. So it's very important to be able to identify each risk factor, but in most of these patients, you need to treat both.
Okay, yep. Great. And so how is blood pressure an indicator of heart health and not heart function?
Sure. So if we want to make it really simple, the heart is pumping against resistance, and the resistance is given by the walls of the arteries. So you have high blood pressure, the heart has to work harder against the arteries, and that can lead to hypertrophy of the heart muscle and enlargement or congestive heart failure. Mm-hmm. Also, in the arteries, in the peripheral arteries, can accelerate atherosclerosis and increase risk for stroke or heart attack. Okay. That's how blood pressure affects our organs and increase the risk for these conditions. Yep.
Okay. So what I'm hearing, just to reiterate for the folks who are watching today, that high blood pressure is a direct link to incidence of stroke and cardiovascular disease.
Yes, absolutely.
Okay. Yep. Roughly about how many Americans are affected by high blood pressure?
So, we have to compare what the old guidelines, with the old guidelines, the prevalence of high blood pressure was around 32%. With the new guidelines that are more aggressive to define high blood pressure, about 1 of every 2 Americans, by the latest definition, will have high blood pressure, about 46%. Okay. Which is a significant increase from the old guidelines, yes.
Right. And would you say that all those patients are going to need medication?
I would say majority of those patients will need medication at some point. The question is whether or not how many of those patients are being treated, or how many patients are even aware they have high blood pressure. Right. We know by different surveys and research that not even 2/3 of those patients are adequately treated for blood pressure. Right. So if we put an axiomatic number, it will be millions of Americans that first don't even know they have high blood pressure, and 2, even knowing they have high blood pressure, maybe they are not receiving the adequate treatment for it.
Right.
Yeah.
So it sounds like it's really important for folks just to make sure they're checking with their doctors and monitoring that.
Yeah, many people, doctor has called high blood pressure the silent killer, because many times high blood pressure do not give any symptoms until somebody have complication for high blood pressure for a long time. Right. Some patients may have symptoms, but many patients do not have symptoms.
So can you talk to us a little bit about what the new target for blood pressure would be for somebody in that kind of healthy range, and what would be that risk range?
Yes, so I brought a summary of the guidelines compared with the old ones with the new. Let's see if we can show that picture. So based on the old guidelines, the definition of high blood pressure was for systolic blood pressure 140 or higher, and for diastolic blood pressure was 90 or higher. Based on the new definition from the most recent guidelines, they drop about 10 points. So now we're talking about 130 for systolic blood pressure and 80 millimeters of mercury for diastolic blood pressure. And when you see in that picture, you can see that there is a significant number of patients that were considered pre-hypertension that now are defined as a hypertensive. And they had tried to make the recommendations very simpler. So instead of just saying, pre-hypertension, those patients will be defined as a hypertensive. And instead of having several stages for hypertension, we have just 1 and 2. 1 will be systolic pressure 130 to 139 for systolic. For diastolic will be 80 to 89. And stage 2 will be more than 140 for systolic and more than 90 for diastolic. If you have stage 1 and your overall risk for cardiovascular disease, doing a calculation for your risk is low risk, you have some time for lifestyle changes that can be defined 3 to 6 months. You have stage 2 hypertension. In addition to lifestyle, those patients most likely need to start blood pressure medications right away.
Right away, yeah. And so with those lifestyle modifications, one of the things that the American Heart Association focuses on is providing those tools and resources for folks to make sure that they can make those changes that can impact their health. So hopefully they can avoid medication for as long as they can, maybe get that under control.
Yes.
But so it sounds like some folks are going to need medication. And so in your experience in working with your patients, are the new guidelines really impacting the work that you're doing every day?
Yes, definitely. When this was released, of course, this was made aware to the public, so many patients become more proactive about checking the blood pressure, going to the doctor, and just because the number of people that is affected.
Sure.
So the first thing we need to recommend as a physicians is to change lifestyle, and that goes from increasing exercise activity, improve your diet. We have this diet well known to people and physicians called the DASH diet.
Sure.
It's a diet that is not just referring to decrease the salt intake in your diet to less than 2 grams a day, but also increase the amount of fruits and vegetables you eat, the amount of grains that you eat. Adopting this lifestyle and this diet, you are able to, in many cases, decrease your blood pressure by 10 to 20 points. But in some patients, they're still going to need to have medications for it. So this is from the individual standpoint. From the community standpoint, I think it's very important to provide the patient and the population opportunity to exercise. For example, for a community, building new trails. For an employer, allowing people to have time to exercise, or to giving a reimbursement for joining a fitness center, for example. Things are happening now. I think insurance realized that this is good for the people to keep them healthy, but also to help them achieve that goal. So I think those lifestyle modifications help people to lower the blood pressure, and many times people may not even need to start blood pressure medication unless they have the other risk factors that they need to be on that.
Right, absolutely. And what's really great, you mentioned a few things that are already happening in the community that are allowing folks to be able to get out there and be more active. And it can be as simple as just getting more steps in, going on those walks. American Heart really pushes complete streets, making sure there's safe sidewalks for everybody. And so it can be as simple as taking a family walk, and then everybody can kind of manage that blood pressure as well. Good. And so what does the new blood pressure guidelines mean for somebody who's maybe never had high blood pressure before? How might it affect them?
Yeah. So the first is increase awareness. So the public, the patient will check the blood pressure more often, will see the doctor. Number 2 is once we define their blood pressure, not with one reading, but multiple readings, the doctor will assess the patient's risk and will decide if we have time to do lifestyle modification for 3 to 6 months. If that patient's cardiovascular risk 10 years is high, those patients probably will need to start blood pressure and not just lifestyle from the beginning. And then those patients will need to be educated, instructed how to monitor the blood pressure, so we increase compliance and a good follow-up with their doctor.
Great. And so, the new guidelines definitely focus on the prevention side, the diagnosis, and then treatment. Can you talk to us a little bit about if somebody has high blood pressure, how often they would need to monitor that?
So normally what the guidelines recommend is to see their primary doctor every month to 3 months until the blood pressure is well controlled on the medication they're using. Once the blood pressure is well controlled, patients should monitor the blood pressure, periodically, at the beginning, maybe even once a day. As the blood pressure is well controlled, once a month, and see the doctor at least twice a year. There's some patients that are taking, for example, diuretics. In those patients, it's very important that they check the blood work to make sure there's no problem with electrolytes or the kidney function. There's certain medications, when we start blood pressure medications, it's very important to have a good follow-up and do the blood work that is necessary to make sure they are tolerating the medications. Also, very important that they check with their doctor about side effects. Sometimes patients stop the medication because side effects and they won't tell the doctors. Patients need to be aware that we have multiple blood pressure medications with different mechanisms, different side effect profile that we can use if one medication fails because of side effects.
Absolutely.
Yeah.
And so one of the questions would be, you mentioned frequency, and if they need to check it weekly as they're trying to get that under control, and when they start seeing their doctor just once or twice a year, can they do that at home?
Yes, so the guidelines recommend that patients should be able to monitor the blood pressure at home. They nowadays, I think the blood pressure machine devices are cheaper than they used to be, so patients can afford it. Some insurance will even cover that. And then there's, technology helps for patients to be able to send those readings to their physicians through the portal, for example. And so we want the patients to be more proactive. Many times in the office, patients have white coat hypertension, where the blood pressure is normal at home but elevated in the office. But we have the other case too, called mass hypertension, which is more rare. Is when patients at home are high, but when they come to the office, they're normal, and the doctor may say, oh, you're well controlled, and we don't adjust the medication. So in addition to the office check, it's very important that the patient monitor the blood pressure and share that information with the doctors.
Great. And so just one or two more questions here, Dr. Antezano. So if a person has high blood pressure, what would be some of those common signs or symptoms that maybe they could look for? Are there some? So
at the beginning, patients may not have symptoms, but some patients at the beginning report headaches or feeling dizzy, lightheaded, sometimes chest pressure, shortness of breath, fatigue. But again, these are symptoms that may not be present, and they might not know until patient have stroke or heart attack, or until develop congestive heart failure, or until they see the doctor routinely, and that's why the routine visits, the annual checks are very important to be able to screen people for this problem. Yes.
Great. Well, thanks so much for helping to answer a lot of these questions today. And high blood pressure, like he was just mentioning, often does not have those signs or symptoms. And he mentioned that it sometimes is called that silent killer. So just really important to make sure that you are checking with your physician, you're checking your blood pressure. You can do that at home, at a local clinic, and so that's a first start, making sure that you go to those regular visits and following your doctor's advice always. The great news about blood pressure is that it can be managed, so it's just really important for you to be your own health advocate and to go ahead and make sure that you're monitoring that. The last thing would be, if you have any additional questions or would like more information, please visit www.heart.org/HBP. And we thank you so much for joining us. Thanks for answering our questions today.
Thank you.
Yeah, absolutely.